Now you're all set.
Great, thank you. Good morning.
Good
Welcome
morning.
to
Good morning.
the Southborough Board of Health virtual meeting for June. And I need to read this segment for recording and doing a virtual meeting. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, General Law 30A 8, Section 18, and the governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Southborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Town of Southborough's website. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner: by finding the meeting at southborough.com/remote meetings. Number in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so despite best efforts, we will post on Southborough's website an audio or video recording, transcript, or other comprehensive recording of proceedings as soon as possible after the meeting. Wow, that was a mouthful. Okay, so did everybody get the materials? You should have agenda. You should have a couple of pieces of public health background information, a couple of proposals that Paul's put forward. Anything else, Barbara? Did I miss?
No, that's it. The nacho, the blueprint, and Paul's ABCDEFG documents. Yes, well, they only go to D, sorry. Yes.
So just check
Everything else is all set.
everybody has the materials for the meeting.
Mhm.
Right.
Okay, great. Okay, Paul, would you like to start us off with an overview of today's meeting?
Sure. Well, there is quite a few items on the agenda, and even though the agenda went out earlier in the week or last, I forgot what it was, we couldn't incorporate some changes. There's been several changes even since then that we'll have to talk about relative to positions and appointments and contracts, which we can get to. But it's not specifically on the agenda as a discussion item. It was only for the board's approval, and we'll get to those. What I thought I would do is we would start off with where we got Emily here talking about the nursing help, and she can fill you in on what she has investigated, found out. Vanessa, I'm so glad to have her here because she's been very helpful on a number of different measures to keep us all ethical, honest with all the state statutes and laws and so forth relative to hiring, even if it is temporary people, provisional people, summer interns, whatever it may be. So we can talk about that when we get to that. There's also the need, and I'm not sure, Mary Lou, whether we'll be able to get all of this done today, even in 1 hour or 2 hours, because I think a lot of it is a series of motions and still in progress. One particularly is the need for an advisory committee.
Right.
We haven't discussed that. The board needs to discuss that, whether they want an advisory committee. We did remind everybody, the Board of Health did have an advisory committee. These are ad hoc. Years ago, I believe it was 2005 or 6, when Louis Faison was on the board, and we were going through a little bit of a because I was retiring from a full-time position, and we were going to be retaining the services of my position on a part-time limited basis, and then retaining the services of a sanitary inspector on a contract, which we did, and that's Dennis Costello. So what we did is prior to that, the board set up an advisory committee composed of several people. I think that was Dr. Cedar was on it. I think you, Mary Lou, were probably on that. And there were several other people, and I don't remember the names, but they were able to give advice as to which direction. I think Nancy Allen from Shrewsbury was on as a person who representing other boards of health staff. So we got a lot of help from other people, advice, and so forth. And I think talking with Mary Lou, we'd like to have the board consider doing the same for a short period of time. This advisory group would only meet sporadically when needed, and to get some input from them, as being basically citizens, mostly with citizens of the town of Southborough, but there could be some other people. And we're not sure how many. It could be a small number of 3 to 5, or it could be 7 to 8, something of that sort. But that's got to be discussed. Let's see here. I'm not sure what this contract with Esri to add information about coronavirus to the town website. Maybe.
Yeah, that's the website I talked to you about, Paul, that Hopkinton's doing. Emily's done some homework on that, so Emily can give us an update on that.
Okay, that was the
COVID-19 specific website.
Antibody testing with that firm.
No, this is a website that Hopkinton has contracted to everything COVID. So to keep all residents up to date on anything going on around related to.
All right, so maybe Emily can talk about that. And then the other thing is leading up to that is that collaboration with possible collaboration with AFC,
right?
Urgent care firm. That's the antibody PCR testing. So anyway, that's the meeting. Do you want to have Emily talk about the nursing staff?
Well, let's
you want to go into?
Let's start first. Get the meeting minutes approved, because we have 2 meetings that we didn't get minutes approved.
Correct.
So let's first look at the May 7th meeting. Does anybody have any modifications, edits, changes to the May 7th meeting minutes?
Nope.
No.
All in favor to pass as is?
Yes, aye.
Yes.
And Dan, all in favor, great. The May 21st one, which was our last meeting, the meeting minutes for that meeting went out with this. Did you get a chance to look at those, and do you have any edits or modifications?
Nope.
No.
Yeah, all approve?
Yes.
Yes.
Great. Super. One down. And the next item we have is results of the annual town meeting as it pertains to the Board of Health budget. Do you want to talk about that, Paul?
Yes, very quickly. The annual town meeting out on the lawn at Neary School. The budget for the Board of Health was approved with there was no holdup on it or questions about it. So that budget has been approved.
Great. End of fiscal year 20 budget, grant shortfalls, CARES Act, MEMA and FEMA. I'm not quite sure what that's about, Paul.
Okay. We have been asked to begin to put together information to the town accountant's office. And Barbara has been very helpful aggregating a lot of information, which we didn't send to you, but we can shortly, because it wasn't finalized, because we hadn't yet reached the end of our fiscal year, which is June 30th. But what we've been doing for their purposes is they need to know where we are short in what we budgeted for and where we had extra funds. We did get extra funds from the state department through the State Department of Public Health. There was a 4,000 plus grant, a 2,000 plus a 3,000 grant, and then Barbara, correct me if I'm wrong, what was the last?
We total about 15,000 in grants.
About 15,000, but we have spent in overtime. That's not overtime with extra hours, mostly for me and Emily. I think it was a total of 17,000, something of that sort.
I have to check, but it's more than the grants.
We're over, but we are told we're going to be able to apply for some CARES Act funding, which will be coming, and that may be administered through the fire department's emergency preparedness person, Neil Espasi, and that's also possibly some FEMA money, which is Federal Emergency Management Agency money, and the MEMA money, which is the Massachusetts Emergency Management. We don't know how much, but they're talking about that whatever we apply for, we'll be able to get 75% reimbursement. We should be able to basically pretty much balance our budget whenever that may be. It could be fall or whatever, after we are able to tally all of these shortfalls. If we're not able to, we will need to go before the advisory committee. It's actually the finance and advisory to ask for any extra funds because of the emergency situation. We're not sure we need to do that yet. We've been told by Mark Purple to wait on that until the proper time comes when they can do the accounting on our actual budget. So in a nutshell, that's where it is. We're kind of a lot of, I know, not conclusive at this time because we're not sure where this is all heading.
Okay.
Any questions?
No, I think it's probably going to come up at each of our meetings, and we'll just get an update where it's at. And I'm getting the same inclination that don't worry, there's going to be coverage for this. And so I think we just know it's on our radar. We'll just keep our tabs on it.
Yeah, I had to listen to a call in yesterday, Mary Lou, board members, phone web call in with Congressman Neal out in the western part of the state, who's now House Chairman of the House Ways and Means Committee, a very powerful position. And he said that there's highly likely, well, he's not positive, but it's highly likely that there'll be another $1 trillion plus funding coming through for cities and towns, among other things, probably sometime in August, September, or October. And that he said they've been assured by the Senate that they might, there's one holdup, you can probably guess who it might be, this one particular senator, but if it passes, it would be signed by the president. That's in addition to the money that's already been that we all received for,
Right.
So forth. But anyway, that was just yesterday afternoon late.
Okay, that's good news. That's positive.
Yep.
I think I'd like to move one agenda item up before we get to the immediate needs, which Emily's going to talk about, the public health nursing help that's needed, options, all of that. Emily, would you mind first just giving everybody an update on COVID-related issues for Southborough? Just because it all probably ties into the discussion of what kind of nursing help and options we have and we need.
Yeah, so our influx of cases has gone down. We haven't had a confirmed case in almost 3 weeks. So we are at 41 confirmed cases. We have a few probable cases trickling in, and those are individuals that have tested positive for the serology testing, but typically it's past infection that wasn't tested back in March or April. But it's the hours going into COVID investigation has gone down significantly. And I hope that it continues on that trend. But obviously we all don't know what to predict, but
Right.
do you want me to address the nursing hours? Or?
Yeah, that would be great. But I thought it would be good for everybody to hear that first. So yeah, just what you thought on hours, needed hours, potential hours, and then options, and then the school nurse issue, which I didn't quite understand. So if you can better explain that, that would be great.
Well, Vanessa may be able to pipe in a little bit because there is some labor ethics laws that that have had to been explained to me in order to an individual or individuals that might be able to do per diem hours or as needed for investigations or support in other areas, mostly related to COVID, but I'm also looking at the possibility that we might have to expand the flu clinics because there's a big push by DPH to make sure everyone's vaccinated for flu as well. So I have been working 35 to 40 hours a week, and I need to get my hours down to the under 20. So I was hoping that we could hire nurses as needed to supplement as needed. Well, we were looking at school nurses because we had been working with them a little bit in the springtime, and they kind of know the system, and they haven't been trained on Maven, but we have been doing like a Google form when they were doing contact monitoring, helping me with that. So ideally, I would like to train a nurse on Maven so that they would be able to input the information and do contact tracing and monitoring again as needed. But there's an issue with school nurses can't necessarily work under the same umbrella or be paid under the same umbrella. So we were looking at Northborough nurses, but if they are still.
Want me to jump in and cover that piece, Emily? Okay.
Vanessa,
I didn't know if you were still talking about tasks or duties, so I didn't want to jump in quite yet, but I'll just give the board a quick overview. So the issue is under the state ethics law that you can't be paid by multiple agencies under the same organization. So although, everything Emily described is completely accurate, it would be easier to bring over a school nurse. They're people that you folks are used to. They know our region, et cetera. So I had a conversation last week or the week before maybe with the school finance director and the school HR director over in the superintendent's office because they're all under a union contract as well. I wanted to make sure that there wasn't any language in their CBA that would prevent them from helping the Board of Health during the summer. And I mean, the good news was there is not, because their contract is not in force in the summer. So from June 30th, to the first day of the year, they're able to do what they want. But, there is still this state ethics question. So I called they have an attorney of the day at the state ethics office that we call, whenever we're not sure about something. It's free legal advice. So when she did call me back, she said, I explained, the parameters of what the board was considering. And she said, okay, she's like, you can do that, but you have to treat it like a brand new recruitment. You have to open it up, to, Southborough nurses, Northborough nurses, et cetera. So, in the end, Paul and I had a conversation about this yesterday. It seems like a time-consuming process to get, just help for during the summer. We would have to treat it like when we hired Emily, a new posting, having that open for 2 weeks, interviewing folks, probably in this environment, and having the Board of Health meet again to appoint them. So, that definitely is an option. I'm not sure it's the best option because if there's another flare up in the fall and Emily's hours skyrocket again, not knowing what the situation will be in the school department, of course, at that time, those folks aren't going to be able to work for us when they're under the contract during the school year. So when Paul and I were chatting yesterday, we talked about, well, the other piece was the retirees. Working with a retiree is much simpler because obviously they're not under contract. Governor Baker has allowed retirees to work. There's no cap on their hours during the state of emergency. right? Normally there's a cap of 960 hours per employee. That's been lifted right now. So, bringing in a retiree, we could do that on like a temporary contract as an independent contractor. That would certainly be simpler than going through the full recruitment. The other thing Paul and I were chatting about yesterday was, okay, well, if things go haywire again in the fall, we don't want to train these school nurses on Maven, et cetera, and then lose them again and be back to square one. So we were talking about agencies like the Neshoba Regional Board of Health Association, trying to figure out, okay, is there anyone over there, even though we're not a member community, could we do some sort of contracted service with the Neshoba region, to get the help that Emily would need, so that's something else. I've been trying to reach someone over there to find out if that's even possible. Sometimes with those agencies, that kind of assistance is only available to their member communities. But I had a situation, last year with the planning community. We're the last town in the metro area planning district. But we really wanted to work with someone from Central Region in Worcester, the Worcester Regional Planning Agency. I had to go to MAPC and get their permission, to do so. So we were able, that was an example of sort of a workaround. So, I didn't get a call back yet from the contact I had at Neshoba, but that was some other information, some research, Paul and I were trying to do yesterday. So, it's a little bit complicated because the school nurses, it would be as if we were doing, starting a brand new recruitment from scratch, so that would take several weeks time to get them going.
Vanessa, I have a question. So I've been working with the Framingham Health Department.
Okay.
And doing COVID investigations. They have 16 of their nurses working, doing the school nurses, and will continue. They asked who would continue through the summer, and they're continuing the summer. And I know of 4 other towns that are doing the same thing. So I don't understand how our contract can be so different than other towns.
Right. I understand from the folks in the school department that some contracts in Massachusetts, some of the collective bargaining contracts that the nurses fall under, apparently some of them, the way they're worded, are for town or school. So that may be why. I'm not familiar with the Framingham contract. I'm very friendly with the Framingham HR director, so I'll certainly call her today, Mary Lou, and ask her how she's been able to do that. Maybe there's some loophole, not loophole, but some workaround, that the folks in the Algonquin office aren't aware of. But that I have heard that before. But I've also been told that it depends on how the way those contracts are worded, town versus school, or do they serve both parts of the region?
Yeah, and it may be that's how it's set up, but they're all, I mean, the people that are working are voluntary, and they're working over and above their school hours. Unlike Northborough, Southborough, Framingham, the school nurses do a lot during the day. So they weren't able to, so they were working for school, their regular school hours, and then they were putting in contact tracing and investigations afterward.
Over and above, paid, I see.
For those hours. Although if things were slow in the middle, they'd make phone calls or whatever. So they were able to do both. And then they asked for volunteers for the summer, and they got some of them to volunteer for the summer. So, I mean, I think we don't know. There's a lot we don't know at this point. And our numbers are going down. So a per diem or, a per diem type placement might be the best option right now. Once we figure out what we're going to do about, the ongoing health needs of Southborough, maybe we're going to factor in more hours for public health nursing in our new plan, but we don't know that at this point. So just to give Emily support, if, like you said, there's a resurgence, or we have to do more, or the vaccine comes out and we have to do mass, immunizations. If we had some nurses that were able to be available without going through the whole hiring process.
I know, that's why I was thinking the Neshoba, Regional Association might be a good option, because it might not be, a great deal of time right now, knock on wood, since our numbers are going down. But, that's the kind of thing that it could fluctuate, week by week, and we would just be changing the amount of money we're paying those per diem people. It wouldn't be set hours per week.
Right, exactly. Right.
Right. So I'm gonna, if you want me to, I'm gonna, continue pursuing, trying to get a hold of someone at Neshoba to find out if that would be an option.
Okay.
Can you
And then
reach out to
check in with
Framingham as well?
Framingham HR. Sorry, Emily.
No, I was saying the same thing as you.
Yeah,
Can-
I'm gonna call Dolores over in Framingham today.
Okay, so am I understanding that they could only work during the summer hours then if we did end up going with school
That's
nurse?
my understanding, that I don't think they would be allowed to, once their contract is in place again, the first week of school.
Okay,
Or
I'll
maybe,
verify that with the district office, but that was basically what they
Because
said. It's not called.
one of the nurses is only part-time and she said that she'd be willing to have hours beyond the summer.
Is she under a contract during the school year as a part-time employee?
I assumed so, but I didn't ask.
Okay, what's her name, Emily?
Mary Rogers?
Okay,
but Vanessa, one thing to ask is that if someone is part-time or if someone works full-time, even though they're under contract, they're only under contract for that school. If they're willing to put in hours after their work, how can we prevent them from doing that? They're doing their job in their regular hours and they want to take a job at CVS or Stop and Shop.
Right.
They're not prevented from doing that.
right, no, they're not, I think it was because they'd be getting 2 paychecks from the town of Southborough. Because we pay part of the assessment, of course, for the regional school district that they're also paid by. So let me call over there and find out about the part-time person, if that's an option. If they're under the same contract or not, I just want to clarify that.
Yeah, and ask if someone could be hired over and above their school hours if they chose to be PRN, like on weekends or something else.
Right, okay. I
That
think the answer may be yes, but the anecdote may be you still have to post it, as if it were a brand new position.
Yeah, but that's what we're trying to avoid. So
I
if you
know,
can,
I know.
and the information that you gather will just help us in our process. And I think we just got to gather some more information. Emily, do you have anything else to add?
Well, I just want to add that there's definitely more that we could be doing. There's definitely more nurse hours besides COVID. As the COVID is slowing down and I'm doing more work related to mosquitoes and smoking and emergency preparedness, it's there's a lot that we could be doing in Southborough, and I know that we're trying to keep it at under 20 hours for nursing hours, but I think that there is a need and there is opportunity to grow the position.
I definitely agree with that.
So just wanted to add that.
The other half of that conversation is that outside of COVID, the Board of Health is only funded for, the 20 hours of nursing, public health nursing per week. So anything outside of COVID that can't be reimbursable, right now, I don't think you have funding for it, at least for the fiscal year that's about to start next.
No, I understand that. I just wanted to.
Yeah.
Well, that's
what I'm
also,
learning in the role now.
that's also a good topic for, item number 2, future needs, the 3 to 5 year staff plan where, you've got, I don't know who put that together, Mary Lou, maybe you did that, but, you've got a second health nurse assistant in there where, maybe this warrants a full-time position. And
Right.
that
And
would
Dan,
be in that
yeah.
3 to 5 year plan.
Yeah, and that's great segue to, I guess Paul's done a lot of work. Most of you, I don't know if you've had a chance to read. I mean, a couple of those documents are pretty thick and have a lot of information in them. But we all know that COVID has sort of highlighted the need for public health that has been sidelined really for many years and not not necessarily adequately budgeted because people didn't see the need or don't really understand what does public health do. And I think it's a great opportunity for us to get Southborough in a really good position to possibly get certified as a public health agency. That's CDC's goal, and the federal government's goal is to move towards public health certification. And some of those documents you'll see as moving, what does it take to have a healthy community, and what does it mean to have a certified health department? And that's part of a little bit of the discussion, that on top of the hours of who's doing what and the lack of expertise we have for certain things like epidemiology and so forth. And so that's the whole thing about thinking about putting together an advisory. And so if we decide that that's the route we want to go, we don't have to delve into the staffing plans and all those other things that are part of this agenda, because that would be part of the advisory. And hopefully, I think Paul has said he would be part of it. Emily hopefully would, any of the board members, and then think about who else would be helpful to really hash through some of this information and get in depth about what does Southborough really need to have a healthy health department.
Right.
Any thoughts on that?
Well, you nailed it, that the times that we're in right now have really highlighted the need for an expanded health department, and to use your words, a healthy health department. And I didn't get to the part where it's we have the ability to be certified, but that seems logical as well. I'm all in favor for it, so it makes a lot of sense, I think.
Yeah, I agree.
I did talk to Lewis, and he's very willing to be part of it, which I was psyched about. And I'm hoping that you guys can sort of brainstorm about any expertise or any people that you think might be good to have on this advisory. We have to put together a plan for the advisory, and what is our expectations of this advisory. Vanessa, I just want to check in with you, because I know when I was on the earlier advisory that Paul talked about, which was over 10 years ago now, I had to, I don't know if there was a charter or there was something specific
So,
that group had,
exactly.
a chart that it had, and I had to get sworn in and all that. Do we have to go through a similar process?
You do, sorry to say, but because we're still doing, basically the public's business, the Board of Health would have to create an ad hoc committee, during a public meeting, and you would have to write a charge for that committee and set up the structure of, okay, 3 residents, 2 board members, blah, blah, blah. With Dr. Faison, since he's not a town resident anymore, I think we could probably designate him as an ex officio member, which, I would highly, recommend. I had Dr. Faison join me on an MMA webinar that I did recently on reentry to the workplace, because he's so well-spoken and articulate in that area. So we would love to see him involved in a project like this. So I'm happy to assist the board in creating that structure and that committee charge, but they would have to be people. It's all applicable to the open meeting law and public records, the same as your board meetings. Those folks would have to be sworn in by the town clerk, appointed by your board, advertised like we advertise for, regular committee volunteers and so forth.
Thank you, Vanessa. I'm glad you clarified that, because when I talked to Mary Lou, she was asking me, and I couldn't remember how it was structured back then, but now I remember. I mentioned Nancy Allen, who used to be Nancy Rogers.
Of course, my old friend.
Yeah, she was ex officio. That's right, because she didn't live in town. Used to work for the Southborough Board of Health.
Right.
She was. That's right.
Vanessa, but we don't have to have all residents, right? We can have experts, can't we, that aren't residents?
I think you could, because for ad hoc committees, it's standing committees created by town meeting. I think you cannot, but an ad hoc committee, I believe you can. I'll just clarify that in the code, Mary Lou, but I'm pretty sure you can, because like I've served on like fire chief search committees and I'm not a town resident. So I think the ad hoc formula allows you to have non-residents, but I just want to verify that.
Okay.
That'd be great.
Nancy, Dan, or Emily, do you have any thoughts on that?
No, I think it's a great idea. I love that whole advisory idea. I think we could use input.
Yeah, I think it's the best first step that we can make.
Yeah, and if we can bring somebody in from the outside that's already gone through the process or is a certified health department in their town, I think that would have a huge impact.
You know what
I agree.
towns, Paul, have already done it?
Well, the regional, Worcester Regional
Okay,
has been done. The Cambridge Health Alliance, and maybe the Cambridge Health Department, but I'm not sure. I think it could be the Barnstable County Health Department, and maybe Neshoba. There may be one out in the Berkshire area. There's a lot of small little mini regional
okay.
health districts out there. I'm not sure, but one of them may be too. I don't know if Dennis knows of any.
Well, I wonder if the state has any, number one, guidelines, and then maybe they have committees where people are available for this.
I can
This
definitely
exact role.
check in with, I can definitely check in with DPH and see what, what guidance they might have. They might have someone there that's willing to participate as well. So I can work on that piece. I'm thinking like a 6-month time frame to try to put this committee together, maybe once a month for 6 months or something. I would think that would be enough time, because if we're going to look at staffing, we need to get that in place before next year's budget.
I
Right.
would just echo that, Mary Lou, if you were going to change your staffing structure, it would be part of the personnel salary administration plan, which
Correct.
I just want to echo that, getting a head start on this, because really by, November, December timeframe, the personnel board wants to be looking at draft job descriptions. Where are we going to classify this, position in our pay plan? Because they take all their final votes, by early February.
Right.
Yep.
Okay, I'd like to take a vote of the board to see if are people in favor of putting together, and I'm willing to work with Vanessa and Paul to get whatever we need in place to put together an ad hoc advisory committee to give us some guidance on the future of Southborough Board of Health.
Yes, I agree with that.
I agree as well.
Okay, all in favor. Awesome.
Hi.
So let's see. The next thing we have is Emily. So I don't know if Dan or Nancy, you had a chance to look at. I only noticed it because I went to Hopkinton's website to look at this 1-day drive up testing day they had. And when I did that, I found that it said to basically access everything COVID, click here. And it's a separate contracted vendor that that connects to your website, and it has everything COVID. Like it has the links to CDC, the links to DPH,
Wow.
all the current statistics it would be all the current statistics for COVID in Southborough. So it automatically hooks up with DPH to get the numbers. So, for us to give our residents up-to-date information without someone on our team having to do regular updates, you know what it's like to update a website and all that stuff. So I asked Emily if she could do a little research to find out how Hopkinton did it, what it cost, and all of that. Emily, do you want to speak to that?
Sure. I spoke with, it's called ESRI is the group. I can send you the Hopkinton link as well as the information that I received from ESRI yesterday. I spoke with like a customer service representative, I don't know, a client services person, and they said that they've been, since the beginning of the pandemic, they have provided local and state governments with this software, and you can sign up for, I believe it's like a 6-month service for free. So
Oh.
I think that it is something, as long as you look at it and you see that it's something you'd want for Southborough, I bet Vanessa would be happy about having someone else update the website.
It
Well,
is- it is
it's
just
not our
COVID.
website. It's,
Yeah,
it
it's just
takes you
COVID
somewhere else.
related.
Yeah.
Well, it sits somewhere else, but it's all basically public information, but someone is keeping it up to date. It doesn't take its place of our Southborough website. It doesn't take its place of our Board of Health website. It's just sort of an add-on, but in the middle of, you know, a lot of people are curious and a lot of people want to know this information. I mean, I get asked a lot, how many cases do we have in Southborough? Fortunately, I know because I'm in Maven, but if someone asked you, Dan, or someone asked you, Nancy, you probably wouldn't.
I
would be
tell them to
nice-
go to the website.
Right, it would be, yeah, well, it would be nice to
One of the
direct it to
benefits
that.
is that it has the up-to-date links to the informational sites, like the CDC and DPH.
Yeah, and even Reopen Mass, it has all that stuff in there too, so, so
It's just a nice user-friendly platform, I think.
right,
Just to,
That sounds great.
yeah. So, what do you
I'm
guys
not sure
think
why
about
they
that?
didn't market it to us. I don't know.
I know,
I'm not
I'm
sure how Hopkinton
surprised.
found out about it, but
Yeah, I haven't seen any marketing for it anywhere, but,
so they're based in Redlands, California. So
Oh, wow.
yeah, it was hard to get through. I made like 10 phone calls.
Oh,
But persistence pays off, I think. I finally talked to the guy a couple times.
I think the graphics of it are wonderful. I was just looking at it. You know, their chart, just jumps out at you. And that's what most people want to know. Okay, what's happened in the last few days here. I would recommend that Emily speak with Tom LaFlamme and get him involved in taking a look at it, especially the 6-month for free part. I just want to figure out, are there any hidden costs there that that might not jump out at us right away. We're also, one of the other things that was funded at town meeting was a part-time tech assistant for Tom LaFlamme, our IT manager. So, I'm recruiting for that right now. So I think, once we get a little bit more help on board, we can, definitely improve lots of areas of the town website. But I mean, the Hopkinton, got right into it. So, it's funny, I haven't heard any conversation on any of our listservs about a product like this. And usually, you're right, we'll be flooded by phone calls and emails, from those kinds of vendors, and we haven't been at all. But it's really impressive looking.
yeah.
Yeah, when I spoke to the Hopkinton public health nurse, she said that it was something that their health director came across. So she herself didn't have too much information on the ESRI. So we did some investigation.
So could we, do we need to vote on this to move forward, Vanessa, for you to sort of look into this and see
I
if
think
it's
it would
something-
be a good idea, just, for you to have it in your minutes. Anything you, well, again, it says for free right now, but, if there are any hidden costs, that would come out of your FY21 budget. But yeah, just for Tom's purposes, it would be helpful to have, indications that the whole board agreed to it.
So I would
Do
like
you
to,
guys want to look at it? Did you have a chance to?
I mean, I'm looking at it now. I think it's a good idea. It seems pretty easy. I don't think it's a heavy lift. So
right. So I think
Okay.
it's, at this point, I think it's more the contractual and the cost issue at this point. If we all think it's a good idea I mean, it's not something that's going to stay forever because it's all COVID related. So I'd like to take a vote to investigate the possibility of us using this service. And obviously it's not yes, definite, no, definite. And we just look into it. And if it's something that we can do, move forward.
I agree with that. Yep.
Yes, I agree.
Okay, we're all in
Move
favor.
forward.
Super. And then the other thing that I sort of touched on a little bit, which is number 4 or D, I guess it is.
D.
D, yeah. Emily has been working with a lot of other health departments because of COVID and getting to know different nurses, and Hopkinton. I don't know how it started. Maybe Emily, you can talk about it. But it was my actually an initial conversation with Bing with the urgent care that does our personnel. I had early conversations with him a few months ago about antibody testing and so forth. And so he wanted to connect to let us know that he was collaborating with the town of Hopkinton to do a 1-day testing, and wanted to know if it was anything that Southborough would be interested in. And so Emily and Paul and I talked about see how Hopkinton goes, see how much work it would be for us as a health department, and the basically cost benefit analysis. And Emily was able to go. Unfortunately, I had an all-day training. I couldn't go, but I wanted to go. But Emily, maybe you can give everybody an update, and then we can discuss what it would be like for Southborough.
Okay. So Hopkinton Health Department or Board of Health partnered with AFC in Marlborough, Natick, and they're the urgent care company. They partnered to do a 1-day drive-through testing event, and it ran from 8 a.m. until 3 p.m. in the afternoon. They did both the PCR nasopharyngeal swab and also antibody testing, the serology. So they had one station where two stations where they had the PCR just drive through, do the swab. And then the antibody was another section where you had to park your car and then go to the blood draw sites. And I believe they tested 271 Hopkinton employees and or residents, and they thought it was a great service. I reached out to Chief Paulus and Chief Achilles, and they said that they would be very interested in supporting it and also having all their staff tested as well. That's about as far as.
Can I interrupt you for just 1 minute?
Yeah.
So I spoke with Dr. Robinson, who's sort of, she's our intensivist in the ICU, because Leslie Chamberlain had asked me if the police and fire. I would just like to check first, because she said there was still some difficulty like with the interpretation of a lot of these results, and she didn't recommend having these mass screenings just yet.
Well,
had you heard anything about that?
Yeah, I have. So unfortunately, Emily and I are on calls with DPH twice a week mostly. And they are keeping us up to date, which the general public probably isn't so much. And serology testing obviously is evolving. There are many companies. Some companies just do a result, an IgG result. Some do an IgM result. Some do both. So the interpretation is different. Some tells that, you're recovering from a recent infection. One is you've had a past infection. But when you do PCR and antigen together, it really gives a lot better information. And although it's evolving and insurance pays for it, I think the bigger question is whether you have IgG or IgM or both, if you test positive, you know you've been exposed. We don't know how long that immunity is going to last, and that's the big question. But at least you know you've been exposed. And so for some of the first responders, they would like to know if they've been exposed.
So are our first responders not getting tested?
A lot of them, no, they're tested if they have become in contact with somebody it's known contact, or they have any symptoms. But
Okay.
this would be
So
a drive-through.
Is it free?
Yeah, your insurance will pay for it.
So you have to register for it, right?
You have to register.
Well,
AFC
I'm just wondering why we want to do this, because is it because it's convenient and it's in Southborough, so
Yes.
people
Yes.
can get to, well, Southborough Medical is doing this, so why can't
So
they
is
just go there?
Marlboro Hospital, so I don't know.
On Newton Street, there's a big tent right on Newton Street, and people can register and drive right up.
Well, you can, but right now that's if you are a symptom or a doctor's order or a
Right.
DPH order. Just the general public can't just drive up and get that test at Southborough. In South.
Well,
Are you sure about that?
I don't believe they have the blood draw there.
Actually, now
antibody
at
testing?
Marlboro, it's now a sputum,
Oh,
believe it or
really?
not. Yeah, it takes a
Wow.
lot longer, but it's less uncomfortable, I
Yeah.
suppose. Mhm.
Wait, Emily, would you say the blood drawn? Would that be the
Blood draw
antibody?
would be the antibody test.
Yeah.
Well, the blood is still
So
for
I don't-
antibodies, but for the
So
other,
I'm just looking at their
PCR.
website, and it seems like that's what they're doing. You have to go, I guess, inside to get the blood drawn, though, at
Right.
over here on Newton Street.
Right. This would
So
strictly
did
be
you
a.
say-
Is this going to cost us money?
That was my question,
yeah,
Dan,
I
whether
don't
it was a
I'm not
fee.
really for this. I got to admit it. I'm not. I think there's enough
Eh.
places people can go, and I still am a little leery about what we're going to do with all this information right now.
So we're not doing anything with the information, and the police and fire are very interested because they can't.
Well, can't they go and, I mean, I don't understand why they can't get a doctor's order.
Well, I guess they would have to mandate it. We'd make it easy, like it would be there, and they might, like they asked if we could have separate hours for them to just, to get their testing done. All the staff would be in one location. It's kind of like a flu vaccine. Why do we do flu vaccine? Why don't we just tell everybody, go to your doctor and get a shot there? They can get a shot there. We don't have to provide a flu clinic. There's no reason for us to provide a flu clinic because everybody can get it at CVS, Walgreens, or their doctor's office. But many
Well,
people.
part of
can't
that is
get out.
convenience, though, right?
Right.
Correct.
Totally.
Or a
It's
big part of it. Yeah.
a major part of it is so that we,
Yeah.
we want to make it easy for people, and this
So-
falls in that same category to me.
Yeah, and I don't disagree. The only thing is, number one is there a cost to us to put this
Exactly.
on? And then, which I don't know if that would be any kind of an issue, because we probably get, funding for it or reimbursed for it. And then the other question would be, in terms of convenience, is just looking into, and I can do that, and I can send out an email later, is whether or not you can just go over to Reliant, Southborough Medical, and do this. Because just from glancing at the website, it looks like anybody can pull up and do it. So I would just confirm that, because that's very convenient location to do it. And then, what's the undertaking for the town to put this on,
So Emily, chime in.
and the cost?
Yeah,
so
Emily, chime in. It's my understanding there's no cost to the town. The cost to the town is the volunteers to help organize it, or any of us or anyone that goes to organize it, or if someone is uninsured. So Hopkinton, correct me if I'm wrong, put together $3,000 that would pay for anybody who's uninsured that wanted to get the test in. And mind you, each person goes through an interview process with AFC prior to, you can't just show up. You register, they talk to you to see if you're appropriate for the screening, the type of screening, and then you have a set appointment block that you can go and get it done. But I can't imagine that Reliant is able to do 200, tests in a day. I mean, I don't believe there's no financial cost to the town, except if we choose to cover uninsureds. And it's personnel that would be helping, and police and fire have already offered that to help us with whatever they can.
Where we're trying to get Emily's hours to a reasonable level, I don't know how this is going to help that.
So it was primarily staffed by MRC volunteers.
Well,
both
I don't
men-
think we have enough MRC to do
but
200
they
and
were pulled
something.
from, they were the ones that I spoke to, most of them weren't local. Beverly, North Andover, Wakefield, Lynn, they came from all over to help. There was about 20 or so individuals who came in under Lisa, who's like a regional coordinator that actually lives in Hopkinton. So maybe she had a
Yeah, I don't know.
ulterior motive to have it in her town. but I thought that they did.
I mean, are other towns other than Hopkinton doing this? Because it just seems like a big undertaking, and I don't know what we're going to do with all these results other than allay people that, if you're not I don't know. I mean, we're not checking all the hospital employees or anything like that. So I just don't really understand, people might be able to allay their, have I been exposed? Haven't I? I mean, if you're asymptomatic and you're feeling good, it just seems like we're reinventing the wheel. There are places these people can go.
I think that it would be a good resource for the family members of people who have been positive in town, in addition to the first responders group. But that's always been the biggest question that I've fielded from family members is, how do I know if I was exposed, especially early on, the March and April families, when they weren't testing close
So if they
contacts.
have been exposed, how is that going to change? I don't really understand if they're, I guess I just don't understand what we're going to do with all this information.
There are some family members that have been exposed and their doctors saying, don't even get bothered testing. So I think maybe in this circumstance, that person might want to get tested. So we would test them almost like no questions asked maybe, or they would go through that interview, like you mentioned, Mary Lou, and they'd still can get tested versus I know somebody here in town who was tested positive. The husband was sick, but they wouldn't test him. So in that circumstance, I think that he would get tested under this, I guess, format.
Right.
Because we have people whose family members test positive that, like, for instance, we have a tech whose sister works at a nursing home and they live together and she tested positive. And, our employee was allowed to come to work as long as she wasn't symptomatic. So, I mean, yeah, it's nice to have the information, but I don't really think it's necessary for everybody and their uncle to be tested just so they can, I don't know. I don't see the point.
Nancy, the person that lived with that person that got to go to work if they were asymptomatic, the
Yeah.
only reason is because they were in healthcare. If they worked in an office or if they worked in a grocery store or somewhere else, they would have had to stay home and quarantine.
Are you sure they're still doing
100%.
that everywhere?
100%.
Okay.
Yeah.
Yeah, healthcare gets
So,
a pass
question.
because they don't have enough healthcare people.
I'm not opposed to this. If Emily, you want to do this and take this on, I'm fine with it. I was just kind of pointing out, what other options are and what kind of undertaking, and to even to Nancy's point, you've already got, you've already overworked, working more hours than you're supposed to. But if you, it's like, knock yourself out. So.
No, believe me, that was my first concern. I was like, how much work is this? So that's why I went and I visited for the setup in Hopkinton and the breakdown.
Emily, did you say that was there a cost to insurance, or is there no cost at all?
So insurance companies are are paying for it, yes.
Okay, so I just would want, though, all of our employees that might get it to know that this is not going through the town's insurer because they're not paying for it.
Yeah.
So it goes through
The
their
town's
private
insurance is not paying for
health
testing.
insurance.
The town's insurance is not paying for testing?
No, they never have.
Crazy.
It's always gone through people's own health insurance.
But
No, it would go through people's health insurance.
Yeah.
Yeah,
But
I
if
just
it-
want them to know that because, I don't want them to have the impression because it's happening on town property, if the board agrees to this, and it's sort of sponsored, by the town to put this clinic on, that it still is going through their private health insurance. They're not
Right.
processing it through the town's insurer.
Well, Vanessa, that would become
Oh, yeah.
very evident when, so if they registered, as soon as they got the phone call from AFC, they explain all that the person has to give their personal health information.
Okay,
They
good.
have
I
to
just
give
wanted
their-
to clarify that.
They have to do all of that before they can even get their time slot. So it would be very clear to people.
Okay,
And when
good.
Hopkinton announced it, it was a partnership with AFC. It wasn't a town sponsored, conducted,
Okay.
It
Was
was,
there a
Okay,
time
good.
frame? Is there a time frame you're looking at?
Emily and I didn't really talk about that.
I
Like
think
July, August, September, October?
the biggest complaint was the heat and the sun from
Yeah.
the clinic last week. So we'd have to scope out a suitable space and, if there'd be.
And do they
available-
provide PPE for all the people doing the tests and stuff, just in case?
Yes, they provided all the PPE.
Now, let me ask the question. If the town police department and fire department employees, first responders, and any other town employees wanted to register, go through the process review and be tested, because they are all covered, I'm sure all of them have the town's health insurance that Vanessa mentioned. But they would probably have to be aware that that's not going to cover them.
No, their health insurance does cover it.
Their
Vanessa,
personal health insurance through their
Personal.
employer.
Right.
Well, the employer is the town of Southborough.
Yeah,
So
that's what I'm confused
Right.
on. too.
Well, there's two different types of insurance. The town has
Yes.
insurance, and that's what Vanessa, at first
Yes.
I was confused too. The town has insurance and every employee has their own insurance through the town. They're two different things.
Correct. I just have a medical question, actually, because Chief Achilles and I talked about this about a month ago, and, we kind of thought it might be a little premature at that point, but say you go and have our firefighters go, they all get the antibody test. They find out they have the antibody. If I lost a whole shift because they were exposed to someone with COVID, and, we've had those issues, so I put 5 people in quarantine for 14 days, if I knew that those people had the antibody, maybe they don't stay out for 2 weeks. But my medical question is, which saves us a lot of money, by the way, but my medical question is, how long does the antibody last? I mean, is that known yet?
So that's.
Well, that
that's
was part of
big
the issue
question.
that with Dr. Robinson saying she feels it's too early. They don't really know how to interpret the results.
I
Right,
see.
that's the $1 million question. How long do the antibodies last? And how much antibody is actually making you immune, right? They don't know
I
that.
mean, we get all
Okay.
these tests, but we don't really know what to do with a lot of the information.
But there's
Is
also
my
an
understanding.
investigation that goes on if someone tests positive, whether it's antibody or PCR. So
Right.
they may not necessarily have to go on isolation. So it's case by case dependent.
How long does an antibody work in like the regular flu? Does that know?
This is
Um,
nothing, this isn't the regular, like, we don't know. So,
I know, but
Well, there's, you could use 2 examples of viral immunity would be measles, where you have lifetime immunity if you have the antibodies, versus the flu, where it mutates every year, so you have
Mhm.
to get the flu shot every year. So the immunity
Right,
will
okay.
for that short amount of time that you
so
may
that's
be
what
exposed to that
it's
virus.
comparable in that regard. but you
Yeah.
just don't know long,
Uh-huh.
you don't know how long the period is.
Right, and gathering the information, the more data that scientists and epidemiologists have, the better they are going to understand it. And so I feel like we're adding to the database that's going to help support this, because every test result goes to DPH. And so DPH will have all of that information that they can look at. We would offer PCR as well. So someone may choose to get PCR, and we might find some asymptomatic people that are positive walking around. And that you found one of those, you've probably just prevented 20 infections.
Right,
Well,
and
I would
Vanessa,
say-
the antibodies, if they have antibodies, it doesn't mean they would have to be out of work. If they had a positive PCR, that's different. But the
Right.
antibodies, they could have that from an exposure 3 months ago.
Earlier, right,
Yeah.
okay.
I think we need some more information, more details. And, you know, if you want to just disseminate that information in an email versus getting back together in a short meeting, I think that that would be fine. And if it requires another meeting prior to our next scheduled meeting, then I think that that would be appropriate as well. Either way, I don't think we. Do
I
we
just
need to
wanted to
take a
add
vote,
to-
Mary Lou?
Oh, yeah. Go ahead.
Go ahead, Em.
I was just going to say that the public health nurse in Hopkinton, Casey Morrow, is willing to support with all her materials. She sent me a whole folder of all her materials that she used, both marketing and informational. So I'm happy to share that with you guys. And she's willing to come help staff it. So she's very helpful.
So would this be open to other town employees or just our first responders?
In Hopkinton, they opened it up to all town employees.
Okay.
And they opened it up really to anyone. So say you live in Hopkinton and you have a daughter that lives in Northborough and they wanted to get tested. They didn't say, no, she doesn't live in Hopkinton, we're not going to test her. So, you know, we could say you have to be a Southborough resident or be employed by the town, or we could just open it. You know, we
Flexible.
have options. But I think to Dan's point, it sounds like people need some more information.
Yeah, I would like more information.
So Nancy, if you have something specific to share, you know, send whatever information you have to the group, and we'll continue to evaluate and process. And if we feel like we need to have a meeting before, we will. Otherwise, we'll talk about it at our next meeting.
Okay.
Sounds good.
Okay. So next on our agenda is Massachusetts reopening and its impact on Southborough. Paul, do you want to talk about that?
Let's see here.
Has there been any impact, I guess, on any, yeah, we heard, had any complaints from any employees, any
There's been a few.
companies?
There's been a few complaints here and there. Some of them have come in through the phone. Most of them are inquiries. Barbara has fielded some of these inquiries come in. There's one that I passed along to Emily about a hair replacement company that's really licensed by the Department or Division of Cosmetology. And I'd forgotten all about them, but apparently somebody complained to the state Division of Labor and Standards that either the employees or patients, or people coming in for a hair fit. Is that what the right word is? Hair replacement? I don't know.
I don't know much about the industry.
Yeah, apparently we're complaining, but it's things like I've had complaints about people who say that this certain individual who's cooking hamburgers over the grill at an establishment in Southborough is not wearing a mask. But on the other hand, when I've gone to listen to the webinars that DPH has provided almost twice a week, they indicate that cooks in restaurants don't have to wear a mask because of there's hazards apparently with wearing a mask if you're bending over a grill and so forth. So, but I had to be gentle with the individual. I said, thank you very much for the complaint. And I did go in, looked at this place, and he doesn't wear a mask. But anyway, there's been things like that. I won't go into all of them, but all of us in the staff have gotten inquiries. Dennis has gotten inquiries about people who still want to set up recreational camps. And it's very difficult, from my perspective, to keep up with the state's plan of opening, because it changes almost daily. And even the webinars of about a third, 25% third is my estimate of the people who Janet Ferguson, Ron O'Connor, Dr. Brown, all these people at DPH are very well meaning, but even they will say, well, we don't know about that. We'll have to get back to you on that. We're not sure if that's, we'll check that. So in the so-called guidance, you can download the guidance after the webinars, but they're 12, 14 pages long. And then they have subsections that you can link to. And those sections are 4 or 5 pages long, each subsection. So you got hundreds and hundreds of pages. And those change. Well, they've been changing every 2 to 3 weeks when the governor comes out with, okay, now we're going into phase 2, but only subsection 2 of phase 2. And then you get stuff on TV, radio, and then you get people who are just all over the place. And you get people, where is it? You know, what we in? But the essence of it is that, yeah, we do know that now restaurants, you can inside, you can, you know, you all heard about, of course, the seating outside, the 6-foot distance. And thank God we don't have a lot of restaurants like they have in the North End and Boston and places like that.
Oh, boy.
Yeah, they're in the road, they're in the street, they block off the street, sidewalks and so forth and so on. But so far we haven't had a lot of complaints, which is good. But I don't know, when it's all simmers down, I don't know when that's going to be, but I don't even know when phase 3, nobody knows when phase 3 is coming. It all depends on the numbers, and the trend is definitely down. And so we're heading that way. But when we'll get there, we don't know. But every day you hear reports about, you know, what's now going to be opening and what's not. So we're doing the best we can to try to keep people apprised, but it's not easy. Even a lot of times I'll come after the webinars and I'm more confused than I was before I started the webinar.
I'm sure you're not the only one, Paul.
Yeah, I don't know if Mary Lou is probably got any with that, or whatever, or Emily, Dennis, and so forth. But I'm just thankful
They're
that
getting better, actually. At the beginning, there was so much discrepancy between what was printed and then how they were answering the questions on these conference calls. But I think that they've been better about addressing that and coming more prepared.
Oh, that's good. Yeah.
So, you know, they were flying by the seat of their pants per se, and now they're asking for questions ahead of time so they can research and go to the right resources to figure out the
I
answer.
just wanted to ask the board their opinion on something. You know, I sit on a call with the Lieutenant Governor and her staff every Tuesday, and it's, you know, talking obviously about a lot of the same information, but, you know, more applicable to the things that, you know, we need to keep going on our end. You know, and she has definitely, you know, indicated that, you know, the governor wants, you know, 2 weeks of solid data of, you know, part 2 of phase 2 before he contemplates phase 3. But she, you know, in my opinion, was indicating, you know, we would very likely be in phase 3 by mid-July. So we're looking at trying to figure out, okay, well, when can we open our buildings again? Because we've been closed to the public since, you know, March 16th. We're doing business by appointment, you know, as people really need to get something done. But, you know, Mark is sort of trying to figure out, you know, all right, by the week after the 4th of July, are we going to be in a place where we can open to the public?
Marie is here.
Curious what the board thought about that time frame.
He mentioned July 8th, right?
The 8th, yeah.
I'm actually okay with it. I know that's probably not what you expected to hear, but I think I think people are dealing with a lot of stuff other than COVID. I think there's a lot of mental health people that are suffering and people with other illnesses that are getting pushed aside because of COVID. People are losing their businesses. I mean, I'm not for people getting infected, but I also think there's a lot more to consider here. So I'm actually, surprisingly, I'm okay with that.
Okay, thank you,
Well,
Nancy.
I got a couple of questions for you, Vanessa. Number one, are some of these employees that you're talking about, are they working from home? Are they furloughed?
So right now, Dan, we are still staggered shifts. Like right now, today, there's probably only maybe 6 people in the building. You know, at full staff in the town hall, we're at 22 people. So, you know,
Okay.
we know it's gonna be a long time before there are 22 people here at the same time. Even if we do open to the public on July 8th, we still will be, you know, at 50% or below. It won't be everybody back in the building together.
Right. And, you know, I think it's kind of bizarre how if you go into a restaurant, the second you get up from your table, you have to put a mask on, but as long as you're sitting, you can take the mask off. So
Yeah.
are your employees wearing masks? Are you going to make them
They
wear
are.
masks?
I mean, I'm in a little office across from the treasurer's office. I don't have a mask on when I'm sitting here in my office by myself. You
Mhm.
know, our instructions are to people, you know, when you get up to go to the copier, to the kitchen, to the bathroom, you know, you're in the hallway doing something, you need to have a mask on. But if you're in an office by yourself, no, you don't have a mask on. You know, and if you're in sort of an outer area, but you're 6 feet away from someone, you know, just sitting alone at your desk, you know, you're probably okay to take your mask off.
Yeah.
We have put up a lot of those plastic dividers in between our cubicles out in the front area.
Right. I just, you know, for me, I'm not going to go into our office and sit down for 8 hours wearing a mask. And so I wouldn't
Right.
want anyone else to do that either.
Right.
So
It's
I can't
basically
see
when they're
somebody
up
doing that.
moving around, you know,
Yeah.
one person in the kitchen at the time, you know, the sanitizer and the wipes and everything are at all our copiers and our postage meter machine and so forth.
Right.
And I'm sure like anything, it'll seem daunting at first, but then like we're in such a groove now, it's almost like being in a car without a seatbelt. When I'm at work, you know, you have your mask, you know, it's just one of those
Right.
things. It's part and parcel of the job now. So, you know, you'll get in a groove and it won't seem so strange after a while, I guess, I hope. I don't know.
My suggestion for when they were proposing the date to come back to having the public come to the town hall was to have appointments or call ahead just so you know how many people are in the building and also you know who is in the building. So I know there's supposed to be a log, but not everyone is logging themselves. So just
So that's another question I had, and I haven't had a chance to go back and check on this, but maybe you know, Emily. So I created a log because that's part of the regulations that you log who's coming into the building. We're not using it yet because nobody is allowed in the building outside of employees. But obviously we need to start using it if we open up on July 8th. And I don't know if you had a call from the library, Emily, about this, but they are opposed to using the log because they feel that, you know, that's an invasion of people's privacy, basically. And is the log a recommendation or is it mandated?
I don't believe any of the things are mandated that are in those standards.
I didn't think so either, you know.
But I think that it helps on the end that we know who is in the building in case they would have to
tracing.
be contacted. Yeah.
Right.
Well, Vanessa, here's one little secret that a lot of the doctor's offices are doing, some of the other towns are doing. And they say, when you arrive to the town hall, text or call so that we know you're there and we'll let you know if it's okay to come in. Now, as soon as they text or call, you have their number in
Their
99%
contact
of
info.
the cases. And then you log it in, that number in with the name of the person, and then you have a log.
Yeah, that's
Can I
true.
just interrupt 1 minute? So I don't know, like, so when you go to, say you go, I did go to TJ Maxx. I'm not going to lie. I was in such shopping withdrawal. So I did go. And they literally have someone clicking as you go in, clicking as you go out. So they know they can only have a certain amount of customers in the building. So, I mean, those people, there's no tracing if you get COVID. I mean, is it just because it's town property that we would have to be?
I don't know. I read that in one of the governor's documents after one of the previous calls with the Lieutenant Governor, Nancy, and I asked about it on my listserv.
Yeah.
And I only found probably 2 or 3 people that are doing the log. Although Sandwich was the first town to open to the public. They opened, I think, the last week of June. So
Okay.
they were using it right away. But when you talk about the clicker, that kind of reminds me of, well, August 1st, taxes are due. There are a lot of people that want to pay their taxes in person. They like coming here.
Right,
They want
right.
to chat with David or, whoever at the counter.
Right.
And,
Yes.
there's a stacked line of people on, the day before August
Tell 'em.
1st.
Right.
Tell them they don't have to pay their taxes, that's all.
Problem solved, right?
There you go.
Yeah, so I don't know what to tell, like, I'm just thinking there's all these other places that there's no tracing of who gets what where.
That's
And
true.
how would you even know they got it in the town hall? Say it was me and I'd just been to TJ Maxx.
I know
I
you
could have
can't
gotten
prove
it,
where you got it.
So I think as long as they're keeping track of how many people are in the building so that you're not
Yeah.
going over the recommended amount. I mean, I just
Which is
think
a
otherwise
conundrum
it's getting
on,
kind of
tax day.
nutty. Like it's really, I mean, you can be exposed anywhere. So to be, how would you know that you got it at the town hall just because that's the only place you went on a particular day?
I
That's
think
not the
it's just
point.
about informing people if they were exposed.
Yeah, so Nancy, if you went to town hall, you had just gone to TJ Maxx, you went to town hall and you got a positive case, you've got a positive test back the next day. And we would notify everybody in the town hall that works in the town hall that you came
I
in
suppose,
contact.
but just not the people at TJ Maxx.
Well, yeah, because
Okay,
if you told us you were in TJ Maxx, yes, we would notify TJ Maxx. They would get notified. Absolutely.
But not all I mean, you wouldn't know all the people that were shopping there when I was there,
But
that, you know what I
The
mean?
point
The
is that we would
employees.
know, we could contact whoever was working that day in the town hall or whoever logged in that day at the town hall, depending on what time frame they were there.
I mean, the
Okay.
whole purpose is to try to contain. The contact
Right.
tracing is to try to contain. So if there is a positive asymptomatic case running around, and they find out, or even if they had their symptoms haven't come out yet, and then they come out and then they get a positive test. The whole purpose of contact tracing is try to contain this.
Yeah,
So-
we're not looking back to where you got it. They
Okay.
are in some aspects, but the basic contact tracing is looking forward to like pull it, rein it in. So it doesn't
Well,
Okay.
apparently this is a hot topic with the Library Directors Association, is the log in general. So,
Well, tell them it's for their safety and everyone else's safety.
I mean, you have to log in when you go to the schools,
I know.
you know?
And it has nothing to do with circulation records, which are, not public documents in public libraries. It's, I don't see an issue with it. If someone's coming, if I go down to the library to check out a book, I don't care that I'm on a log, that wouldn't bother me at all, but.
I can tell you at town meeting, there was 170 or something residents and we asked for phone numbers, and to my knowledge, we only had one person that had an issue leaving the phone number. Felt it was a violation of privacy and all this stuff, but one out of the whole group, to me,
There were 188 registered voters, so that's pretty good.
Yeah, so there you go. So we had only one that maybe Jim can speak to, but Emily and I were there, and we only had one person that created a problem.
Okay. Thank you.
And like you said, I mean, that's what we said. It's for your safety. It's not going to be shared with anyone. And it's only if we find out in the near future that you've been exposed, then we want to be able to contact you.
Well, and I think it would be especially important on a day like August 1st, because you don't want to overpopulate the desk, right? You don't want to have people standing there waiting their turn.
Right. No, I was thinking on that day, David's at the counter, Kristen or Brian can sit at the table out front, we set up kind of, a temporary station because they just need to be stamped, match
But
the
is
check
it-
with the statement.
would it be crazy to set up a tent just for that day? Set up a
Yeah,
tent
outside.
outside?
That's what I was just thinking, Mary Lou.
We
as-
know that
as-
your outside will
Right.
will be a major difference in,
Yeah, so not let anybody in the building. I mean, on occasion, we have to, print something for someone if they didn't bring their little statement with them, but I think that's a good idea to set up, a tent in the parking lot.
I mean,
Yeah,
think
that's
of it,
not a
Laura.
bad idea.
You could even do drive-through if you wanted to.
Right, right.
Get in line, drive up and,
A lot of communities are doing that.
yeah,
The town of Franklin, their town hall happens to be in an old medical building with an old drive-through window, and nobody's in the building. They're all going through drive-through now.
They actually, the testing now at Marlboro is a drive-through window. They took the tent down and they fabricated a drive-through window.
That's funny. Yeah.
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 Wow.
No, I think that's a good idea because I don't think even if we're open to the public, keep them out of the building on a day that we know it's going to be crowded.
right.
I mean, we're trying to emphasize, of course, drop off in the green mailbox, pay online,
Right.
But there are those folks that still want to come.
Yeah. Okay, can we move on?
Ken, I just want to, I didn't know this was, I thought it was just an hour, and my mother's turning 88 today. And I have to get her a Pickle House Reuben or she's going to have my head. So I didn't know.
Get
Is
me
there?
one. I'll take one.
I think we've really covered
check-
most things, except if Dennis has anything urgent and
Well, we got a couple of things still.
urgent.
On a
Okay.
triple clock right
Board has to decide.
Is
what
there
you're-
anything, Dennis or Paul, you have that needs a vote before Nancy goes?
Yes.
Okay.
Yes. If you go to the second page,
Okay.
regular board
Of the
health
agenda?
items, discussion and vote of the agenda. Second, did you get a second page on the agenda?
Yep, yep.
Okay.
Mhm.
The sanitary inspector's bid submission needs to be approved. Contract for fiscal year. Bid award. He submitted his bid. I have it right here on the floor.
Okay.
He was the only bidder. Okay, but I'm just jumping. I'm going to jump all around now. What is not on here is that, and again, it couldn't get on the agenda because it was a call from Aldo Cipriano, who informed me that I had called him 2 weeks ago to see how he was coming with the review of my employment contract, which he has to check off for the legality of the contracts, both mine and the sanitary inspector. And he said, "Oh, Mr. Brzezinski, I'll call you back in a little while." And he did. I could tell something was up. So he called me back and he says, "All right, I found out, I got the news. Your board can no longer enter into employment contracts or contracts generally." I said, "What?" He said, "You're just serving. That's it. No contract." I said, "No, it's in chapter 111, section 27. It's been in there. We've had special counsel, human resource counsel, labor counsel review those in the past before you were town council. I'll do it." "No, it's not in there. It's not in there. I tell you that. I gotta go. I got." So he had to rush through. He had a lot of other comments that he couldn't finish. But so I went home. I checked chapter 111, section 27, and sure enough, he was right. The word contracts is eliminated from one of your duties. But you can still employ people. You can still hire people. You can hire directors, agents, a doctor, whatever, secretary, to keep to fulfill your duties and responsibilities. However, you just can't have contracts. So that being said, we're still waiting for a letter, but I think he called and talked to Mary Lou. But I haven't seen the letter yet. I don't know if Mary Lou got the copy of his letter, review letter. But anyway, so that basically is holding up, well, you can't sign my contract, but I did send hastily a lot of information to you, and I apologize for that, but it was thinking that, well, this discussion I had with with Mary Lou about getting a 3-year and 5-year scenario of possible alternative events. What might we do? Alternative considerations. I call them options. I'm not going to go through all of those. I also decided to print out a reasons and justification for embarking on a restructuring local board of health. That, again, all those sort of things I think could go to this advisory committee. I also laid out a diagram, which some of you should have gotten. It looks like this. I'm not sure if that, but anyway, it's just a diagram showing a 3 to 5 years. These are just scenarios. But the other thing is, I printed up guessing that I would need something because July 1st is coming along very quickly and I don't have a contract, no debt. So basically, I would either have to volunteer my services or whatever. To whom it may concern, and it's basically addresses this chapter 111, section 27. And it's basically just a verbal, a communicator appoint me. In the meantime, Vanessa thankfully has said that she was going to check into this with a labor council that the town employs, that covers these things in a little more detail than Aldo, which is general town council. But my 1-page letter, I don't know if you got that, to whom it may concern, basically just says, we're appointing you. I'm supposed to do the same thing for Dennis. We could wear it up one, but I didn't have time because to do his, but it just spells out the remuneration as approved at the town meeting. No more, unless there are special funds from MEMA or FEMA or the CARES Act or whatever. The hourly rate from to end June 30th, 2021.
So, Paul, do you want me to just give the board a very quick overview of the Labor Council opinion? So the end result is, to cut to the chase here, that Aldo has said a contract is no longer appropriate, for Paul or Dennis because of the way that statute has changed. I was not aware that the statute had changed at all. But basically the workaround, because July 1st is next Wednesday, is that we could draft an engagement letter for the board to sign that basically conveys, the pay and any other compensation, et cetera, that was contained in the contract. It just can no longer be in the form of a contract. So I kind of phrased it as, to our Labor Council, can we basically take that information and put it in an engagement letter, signed by Mary Lou, preferably as the chair of the Board of Health. And our Labor Council agreed with that. He said, that is, a perfectly, simple and efficient, workaround, for this right now, since, we are basically in the 11th hour at the end of the fiscal year. So I told Paul I could work with him to draft that, for both he and Dennis. It would be by recommendation that, so you don't have to meet again, that the board, designate, the chair to sign that letter if you're agreeable.
That sounds great. Thank you, Vanessa, for doing that.
Yeah, that sounds good. And I'm happy to come down, and whenever it's ready, just let me know and I'll swing down and get it signed.
Okay. It's still something we'll have our labor attorney review quickly, but I'll send you a draft, Mary Lou, so you can get a look at it first.
Do we know when this law changed and why we weren't notified of this?
I know,
No.
that seems nuts.
It's a good question, but I think because of the documentation, Mary Lou, that you sent on the, and we sent copies of the natural thing, but more particularly the Blueprint for Public Health Excellence that was put out by the Department of Public Health in their committee,
2015.
which you have a copy of.
Yeah, that's 2015.
Well, it started in 2000. It was basically finished and executed that a year ago, June 27th, 2019. Okay. My guess is that this change in the legislation happened sometime between 2015 and 2019, probably more closer to 2018 and 19, but we're not sure. We're not sure who. We know that they reorganized the whole legislation to basically allow for regional health districts, which they had before, but this is basically far more detailed than it was before. The other thing, that it also has is that it has a restructuring of how to finance these. It didn't before, it was just basically a year-to-year budget. Now it's basically you pay for with an assessment, similar to regional schools, I should say, mosquito control districts. Actually, the Turnpike Authority is a special state district. But anyway, any of these special local districts are usually an assessment. The bill goes to the assessors, they have to pay it, which is a much better structure. So somewhere along the line, the legislature saw fit, must have been through somebody's impetus to change that and eliminate that word contract. So it is not there. Aldo is correct. So anyway, to move this along, I think Vanessa's, she said it'd probably be better. My letter was just my own, to whom it may concern, it's an appointment letter. But I think engagement letter, if they already have a standard format, let's use what Vanessa is suggesting in the format that the special counsel, Labor Council uses for engagement, like you say, and then have Mary Lou. You've already approved conditionally my contract.
Right.
I thought
already.
so.
You did,
Right.
and it's just basically waiting for Aldo. What we haven't proved is we got Dennis's. It'd be the same wording. It just has to be adjusted for the time. It's a 3-year contract, so this would be a 3-year engagement letter, I guess. But I can talk to Vanessa about that because that was a
Okay.
bit.
The board needs to decide who's the chair, the vice chair, and the clerk for the next year.
Thank you, Barbara.
Mhm.
Well, I'd rather not be the chair just because I'm kind of still pretty busy at work, and I feel like I don't know that I'd be doing it justice. I feel like Mary Lou's really been so vital as chair through this whole pandemic. So I would vote to keep Mary Lou as chair if she's willing to.
I
For-
second that.
For 1 year? For 1
What's
year?
that?
1 year.
For 1 year, right?
Yes, please.
Okay.
If you don't mind, I just feel like I don't have,
Because we made an
Enough.
agreement that Dan would take over, but
Well,
I agree with the current situation. So
I
Dan,
just feel like you're working more closely
it's
with
just a-
what's going on right now.
Yeah, and if it's just a title, then that's fine, but I can't replace your
No.
experience, your knowledge, the efforts that you're putting in. I've, I just like you, I've got a full-time job, plus I got my kids running around here all over the place. And, so I don't know how much more effort I could put into it
Right, I know.
to even come close to what Mary Lou does. So, and you've got far more experience, but like I said, if it's just a title, then that's fine, but you got to keep that in mind.
all right, one more year, but you're
Yay.
picking it up next year, Dan. That's the plan.
Okay.
Sounds good. Thank you. I appreciate it.
All
Me
right, so
too,
we'll
Mary Lou,
mark
thanks.
the minutes, then it's unanimous. Keep the same slate of offices, chairman,
Yes, please.
clerk.
Yes, we vote to keep the
Yes.
same.
All right.
Thank you.
Thank
All
you. Where'd your cat go, Barbara? I thought it
My
was
secretary,
mine. She looks so much like mine. I'm like, how the hell did my cat get into
you're that big.
her square?
That's all.
I know Nancy has to go. Is there anything
I
else?
do.
Or, Paul or Dennis?
No, the other things I think can just wait. They're nothing in the way of a vote. I think you covered everything very well. Obviously, I'm not going to belabor you with all of those options, but I just would highly recommend.
That will be really helpful for the committee, Paul.
Yeah.
It wasn't wasted effort by any means, so
Okay.
don't think it was. It's going to be very helpful.
And if you got a sleepless night or evening or whatever, and you're out in a glass of wine and read something, you get a chance and feel the inspiration to read some of those options, I would really appreciate it. By all means, they're meant to be
It's
just,
better than melatonin. No, I'm kidding.
they don't put it too fast, but they were meant to be basically a broad brush, which is what I talked to Mary Lou about, just putting something together. What I thought, there's 4 different scenarios. One is to do nothing. We could just do nothing and keep the way we are. But then we run into problems. By the way, one other thing I just want to mention, and I mentioned this to Mary Lou and Vanessa, is that Aldo said what is happening is apparently boards of health and health agents and both health directors and public health nurses are being sued liability-wise because they are making decisions that apparently the private sector does not like. And therefore they're being sued for overstepping their bounds. So they have to be defended by the town council. And he said, with the contract, I cannot defend you because you're not an employee, Paul. So
Right.
I have to get private liability insurance if I want.
Mhm.
So anyway, but
All
just
right.
warning you, you are covered. You board members, you are covered. I believe Emily is covered, but this is something again, I don't know, insurance. But supposedly that was going to be in Aldo's letter. That was the real impetus for him, aside from the fact that the contract word was missing, was the liability insurance. Apparently he's covered because he's getting all kind of blogs from other city solicitors, town councils about about having to defend staff and boards of health for making quote wrong decisions on this COVID guidance.
Right.
And there has been a lot of on the webinars. There's a lot of I hear a lot of public health directors say, "Well, I need to know because I don't want to make the wrong decision. My counselor has told me my board." There's a lot of stress out there. There's also now they're emphasizing because of the stress on not only board. We not so much other towns that have a lot of COVID situations and
Nancy's on.
What's that?
I said Nancy's unstable there. I see you.
Oh, sorry. I am unstable.
But they're offering all kinds of psychiatric.
Question, did you go over the EEE determining who's
Oh,
going
thank
to be
you.
the contacts for
Oh
AAA?
yeah. Do you want? We have to. Thank you for bringing that up.
Let's let Nancy go. She's got to
Oh,
go.
all right. Thank you, guys. I'm glad you're
Oh.
all well. Stay healthy.
Nancy,
We'll
Yeah,
still
you
have,
too. You too.
Thank you.
Bye, Nancy.
yeah,
I don't know how to get out of
Kim
here.
Deschamps.
Oh, how do I leave? I'm sorry. I don't know
Hit
how
the
to
red
leave.
button in the bottom.
Yeah,
Red
leave
button at the bottom.
meeting.
Leave meeting.
Leave meeting.
Yeah.
Shut your laptop.
Last few years, the state DPH, Dr. Brown, who's the veterinarian at DPH, wants to have a first contact and second contact person, name, phone number, in numbers that this person can be reached 24/7. Last year, I believe you appointed Neil Aspesi as I think with the cooperation of the fire chief. And I'm not sure who is second on the call down list. And I have to check that. I don't know what we did on that last year. But there again, you can appoint anybody. You can appoint the same.
What's the purpose of having a 24/7 contact for AAA?
It's for AAA in case what is the mosquito control district, if they get in their samples, in their when they collect samples of the mosquitoes, if they find that there is a number of species that are spreaders of EEE, the equine encephalitis, they have to alert the Department of Public Health and Department of Agriculture and alert the cities and towns where they find those samples. And there's three categories. One is emergency. One is, I forgot the three categories, to be honest with you. But do you remember last year they came out with those different categories of alerts? And Selpro is put into the second category at one time, and therefore they call for aerial spraying. They've already done some land ground larval side spraying this year, but no aerial yet. But
Right.
that's going to be necessary because of the fact that we're sort of in a drought situation, but they don't know. It runs a 3-year cycle. So if the EEE rears itself as it has in the past year, we're in the second year of the 3-year cycle. Therefore, they would like the name of a person who they can contact 24/7.
Can we just keep it the same?
We can look up and see who is for last year, if that's what you want. Sure.
Yeah, I guess I'm just not I don't see the 24/7 thing. Like, what action are you gonna take immediately? They couldn't wait 8 hours until the office opens. I don't, not sure I understand that.
Yeah, I'm not all for exactly clear on all of that either, Mary Lou, other than the fact that I know last year there was a lot of hastily made phone calls because of the fact that they didn't anticipate the Triple E coming into our territory. That's always been just in the Bridgewater, Easton, and that section, Carver and Plymouth area. And they didn't think it would come this fast and in so many communities that it did last year. So what the alert is for, from what I understand, is to alert the town board of health and first responders and your emergency preparedness people to basically, if they decide to take action, to close down all the public lands for people. And that has to be done very quickly. We did that one year, remember?
Yeah.
Last year, where we have to declare all the public lands are closed for access to the public. If people still want to travel on those land, they're not supposed to, I don't think, to be arrested, but private property, they can, no problem with it. Anyway, I think that was the sort of thing that was very hastily done. But I can check on all of this if you want, get back to you on that.
Yeah, the other part of that, Mary Lou, was if they had a high concentration, was setting up a spraying pattern, which streets, which town, and which streets in town. And that was done pretty much immediately. So where I think Southborough is scheduled, let's say Tuesday nights for aerials for spraying, truck spraying. If you had a positive mosquito Triple E or case in town of a person with Triple E, then immediately, so Wednesday they would come out and spray the affected areas. So
Right.
you need somebody just to get the information to and from, then put it on the.
Yeah, what is that? What is
all-
that phone system? Do you know, Vanessa? Neil knows it. It's basically a phone system that goes out, alert. It goes out to all the residents.
It's code
Reverse
red,
911 or code red.
code red.
Code red. Code red.
Or the
It's the
Han.
Code red system, and they did that.
And DPH did have a call, I think last week or the week before. I don't know if you or Dennis or Paul were on it, and they said that they are putting together a much more aggressive spraying plan across the state. So they're thinking with that spraying plan that there will be less opportunity, I guess, for
Yes.
AAA.
Yeah. Yeah,
I'm
they
on-
had last year. Dr. Brown mentioned that they had to work so quickly. Then we ran into all kind of weather issues, both wind and rain, that interfered with the aerial spraying
Right.
here, and it didn't work as well. But this year they hope to be better organized.
What were you going to say, Dennis?
Oh, I said there's the mosquito teleconferences right now. It started at 11.
Oh, okay.
Fourth, trying to get some information, but I think it looks like about the same one that they had maybe 2 weeks ago.
2 weeks ago. Okay. Okay.
Yes, fairly similar.
Okay.
They did do that one.
So I guess, Paul, maybe you could check and see who was on it last year. And if we need to connect by phone, just call me, you can call me.
All right. Okay. All right. We'll do it that way.
Was that the last thing we had, or does Dennis have anything? Any?
Quick
inspector
thing,
report?
for Emily, I may be sending you a camp application.
Okay.
The only one, and it's a pain.
Yeah, I'll probably have it tomorrow.
Okay.
They sent the application. He's got some things he has to do. The guy's actually done a fairly decent job on it. I was kind of surprised. So we'll see anyway. But they still got to get their healthcare stuff in order, which he has in process. His queries and stories are in process. Everything else looks fairly good. So when I get all the information, I'll send it over to you.
Okay.
And if we can do it, fine. And if not, because I think,
What is the date?
maybe he was looking at July,
The 13th of July, that week I thought he wanted to start.
pretty quick, so.
Kind of camp.
Soccer?
Soccer,
Yep.
Sign me
where,
up.
what facility?
I know
Talking
I
at,
said,
Field.
Town soccer field at Neary School?
yeah,
Okay.
The
But
road was blocked down there, Dennis, this week. Did you know that?
this was I was gonna call he said he's been in touch with the recreation department
Okay, good.
to find out, number one, if he has access to the field, which,
Exactly, because they're doing a lot of work on a rec project right now.
and
So
number
if he's
two,
in touch with Tim Davis, that's the right person.
number two, if he's got access to the school.
I doubt
Like-
it.
Yeah, I'm saying, I doubt it, but he needs somewhere to go.
Well, there's a fellow by the name of Mr. Lavoy, who is under the superintendent. I can give you his name and phone numbers, Dennis, at the office. I don't have it with me here.
Yeah, well, I'll get that from you later, but I want from the applicant.
Yeah.
Right.
Because we didn't even have access to the building during town meeting, so I don't think they're gonna do that for a camp.
I would agree with you. And that's why I gotta get him to circle back and say, actually, what is your plan for thunderstorms, whatever?
Sure, sure.
So if he can't have access, then I'm guessing we cannot issue a permit.
Right. I just wanted to mention to the board that we've only had one application that we approved for outdoor dining, and it's at Ola, the
Yep.
Mexican restaurant at White's Corner.
Expanded outdoor dining? Or just the same that they had?
They weren't really doing, I don't think, that much before, Mary Lou, so this would be taking up parking spaces on the
Oh,
property.
okay, yeah, because they do have like 3 tables out there. They've
Okay.
always,
Just the little ones right in front.
yeah.
Yeah, so expanded, yes, in
Oh,
the
great.
parking lot.
Awesome. That's great. Glad we can help.
Yeah.
ironically, I ate there last night. It was delicious, but
Oh,
they wouldn't, you can't eat inside there. I don't know what the reasoning was.
It's really small inside.
it is little, yeah.
Yeah. But yeah.
So
that's good.
you were sitting outside then, Dan? Did it
No, I
go
just
okay?
called it in and picked it up.
Oh, okay.
Yeah.
Was the seating set up yet outside?
No.
Okay, the board just voted Tuesday night, so they must
Yeah.
be getting ready.
Great.
All right. So I think that's it, Mary Lou.
I think so. I think we plowed
Yeah.
through a lot of stuff. So
Certainly did.
that was great. We have a lot more on our schedule. I know we generally do not meet in July, but I think we might have to do something just so we can get this advisory group going, and maybe a very shortened meeting. But if we can plan on doing a short meeting in July, I think we need to sometime mid-July.
Okay. Yep.
All
I
right.
guess.
Okay.
All right.
All right.
I'll be
Thank you, everybody.
Thank you.
Stay
All right.
safe.
Thanks. Take care.
Bye-bye.
Have a good day.
You
Thank
too.
you.
You too.
There we go.
Right. I'll talk to you later, Vanessa, on the
Yep.
update of, okay, great.